2.
Hi everybody, thanks for watching. Dr. Meyer and I just wanted to take a few minutes and give you an update on some things going on in the hospital. But before we do, what we want to convey with our sincerest gratitude is the tremendous work that you guys are doing to care for the patients of Fremont County. We could not be as successful as we are if it weren't for you. So without any further ado, Mel, let's give them an update on things that are going on.
Perfect. I agree with John. Thank you all so much for the effort and the time that you put in to help us take care of the patients. I do want to say that this is a moving target. Nothing is absolute. We don't have clear data to define what we're doing, so things are changing day to day. And again, thank you for your help and patience while we work through that. Please make sure that you do your daily PPEs. Make sure you don and doff appropriately. Make sure you wash your hands between touching anything before you see a patient. Just make sure that you keep your safety as paramount. We've been working with multiple entities around the country, around the state. We're guiding everything we do off of what CDC says and off of what the Wyoming Department of Health says. I know John has been in touch with the county on a daily basis on a county meeting. I meet with Dr. G at a noon conference, as well as most of the other docs, or a lot of the other docs, to make sure that we're doing things together and appropriately. Just for some numbers for you, if you have any questions, if you get sick or don't feel well, make sure you stay home if you're running a fever. Call Nikki Urbakite. Her number is 330-6311, or that's actually the COVID protocols that you can access. Nikki's number for work-wise and patient safety is 851-0986. And if you have any family members that have questions about the COVID, there's always the Wyoming Department of Health COVID number that they can dial 211, which is Monday through Friday, 8 to 5. Thank you again for everything that you're doing. John?
Yeah, just a few other things. So you know, we've put some limitations on outpatient surgery and elective surgeries. We've done the same with lab and radiology and other diagnostic services. We've expanded the ICU to include a larger capture area for patients that are in respiratory distress or need mechanical ventilation. We've closed down the cafeteria. The response has been absolutely phenomenal. One thing we do know is we're probably still in the early stages, and so we do expect that things might get a little worse, but there's one thing we're confident of, and that's our ability to manage through this. If you do have any questions, you can direct them to Lindsay Anderson, to Dr. Meyer, and to myself, and we will respond as promptly as we can. Thanks everybody. Let's stay in this together.
Thank you very much.